All right, welcome to the Explainer. Today, we're going to crack the code on something you've probably seen a dozen times, but maybe never fully understood: your blood test results.
You know the feeling, right? You get that report back from the lab, and it's just this wall of abbreviations and numbers. WBC, LYM, Newt. You're looking at it thinking, what on earth does any of this mean? Well, it's not just random data. It's actually a message, a dispatch, straight from the front lines of your immune system. So that's what we're going to do. We're going to pull back the curtain on one of the most important parts of that report, the white blood cell differential. We're going to learn the language of your immune cells so you can understand the incredible story they have to tell. So let's get started and meet the soldiers on the front line.
Okay, first things first, let's meet the cast of characters. The easiest way to think about this is to imagine your immune system as this highly specialized army. Your white blood cells, they're the soldiers. The differential is basically just a roll call, telling us who showed up for duty and in what numbers. And this chart breaks down the whole squad. These are the 5 main types of white blood cells, also called leukocytes. And as you can see, they're definitely not all present in equal numbers. The vast majority are your neutrophils and lymphocytes, while the other 3 have much more specialized roles. But trust me, every single one has a very specific and crucial job to do.
Leading the charge, we have the neutrophils. These guys are the most abundant, making up the bulk of your immune infantry. Their mission is simple, it's direct. Find any invading bacteria, eat them, and neutralize the threat. They are your absolute first responders when a bacterial infection pops up.
Next up, the lymphocytes. Now, if neutrophils are the infantry, then lymphocytes are your special forces. They're all about highly targeted, strategic missions. This is where your body gets really smart. One group creates antibodies to tag invaders for destruction, while another group goes in and attacks your own infected cells directly. It's basically the intelligence and elite operations wing of your immune response.
Then you've got the monocytes. I like to call these the heavy-duty cleanup crew. Not only do they also gobble up and kill bacteria, but they are absolutely essential for clearing out all the cellular debris after a battle. Plus, they play a huge role in signaling and directing the rest of the immune response, kind of like managing the battlefield.
And finally, we have the rarest of the bunch, eosinophils and basophils. Think of these two as the specialist hazmat team. Eosinophils are key for regulating allergic responses and fighting off parasites. Meanwhile, basophils are all about mediating inflammation. They're the ones releasing chemicals like histamine during an allergic reaction.
Okay, so now that we know all the players, how do we actually start decoding the message in that report? Well, the first and most obvious clue is when the numbers change. When the percentage of one of these cell types goes way up or way down, that is a powerful signal. And this is where it gets really practical. You can see how directly a cell type maps to a certain condition. A big spike in neutrophils? A doctor's first thought is almost always a bacterial infection, because that's the specific enemy these cells are designed to hunt. A jump in lymphocytes? Now they're probably suspecting a virus, which needs that more targeted, special forces response. High eosinophils? They might ask you about allergies or if you've traveled recently. Just this simple roll call gives an incredibly powerful first clue about what's going on in your body.
But the story doesn't end with a simple head count. Oh no, the next layer of clues is hidden in the physical appearance, or what scientists call the morphology, of the cells themselves. Lab professionals are looking at these cells under a microscope, and what they see can be just as important as how many of them there are.
This is where the detective work gets really fascinating. A lab tech isn't just counting cells. They're looking for unusual suspects. For example, they might spot a hypersegmented neutrophil. That's one with a nucleus that has way too many segments. To a trained eye, that's a classic clue that points directly to a vitamin B12 or folate deficiency. Or maybe they see variant lymphocytes, which are a huge indicator for a virus like mono. These are the visual fingerprints that add critical detail to the story.
And sometimes these visual tells can point to pretty rare hereditary conditions, things we're born with. For instance, a cell with giant lysosomes inside it is a telltale sign of something called Chidiac-Higashi syndrome. Or a neutrophil that isn't segmented properly, called hyposegmented, could indicate Pelger-Hewitt anomaly. And seeing abnormally large platelets right alongside those Dole bodies we just mentioned, that could be May-Heglin anomaly. Every single one of these rare disorders leaves its own unique visual signature on the cells.
So far, we've been talking about the body's normal response to outside threats. But what happens when the defenders themselves become the problem? This is the most serious chapter in our story.
when the white blood cells start to multiply completely out of control, which can lead to cancers like leukemia.
The first major clue here is this number, 20%. According to the World Health Organization, this is a critical threshold. If more than 20% of the cells in someone's bone marrow are these immature blast cells, it meets the definition for acute myeloid leukemia, or AML. This number is really the dividing line between the body just having a severe reaction and an actual diagnosis of acute leukemia.
Now, this is a great example of a diagnostic challenge. Sometimes a really severe infection can cause the body to pump out so many white blood cells that it looks a lot like leukemia. This is called a leukocyte reaction. So how in the world do doctors tell the difference? Well, they have to look for deeper clues, like the presence of something called the Philadelphia chromosome, a genetic marker specific to chronic myelogenous leukemia, CML. They also use other tests, like the LAP score, which is typically low in CML but high in a reaction to an infection.
And the clues can get even more specific than that. Take these two cancers of the plasma cells, which are a type of B lymphocyte. Multiple myeloma actually damages the bone, creating what are called lytic lesions, and it produces a specific antibody known as IgG. A really unique thing it does is cause red blood cells to stack up like coins, a formation called rouleau. But Waldenstrom's, on the other hand, doesn't mess with the bones, and it produces a completely different antibody, IgM. These are tiny differences, but they have huge diagnostic implications.
And sometimes the clue is right there in the name, which you gotta love. Hairy cell leukemia is a rare cancer where the lymphocytes literally look hairy under a microscope because of these fine little projections sticking out from their surface. That super distinctive look, combined with the positive results on a specific chemical stain called TRAP, is what confirms the diagnoses.
So let's bring this all back together. We've seen how all these different clues, the raw numbers, the shape and appearance of the cells, and even specific genetic and chemical markers, all combine to tell a remarkably detailed story.
So the next time you get a lab report, I want you to remember this. It's not just some sterile list of data points. It is a snapshot of a dynamic, ongoing battle that's happening inside your body at that very moment. It's a story of defense, of reaction, and sometimes of the defenders themselves going rogue. Understanding these clues turns a confusing piece of paper into a really powerful tool.
By learning to read the dispatch from your body's own army, you become empowered. You can ask better questions. You can have more informed conversations about your own health. And really, that's what this is all about. Decoding the incredibly complex and fascinating stories that our bodies are telling us every single day. Thanks for joining me.